12 viewer has a great question this week about organ donation. Local 12's Liz Bonus asks the experts to answer it in today's Medical Edge.
Dr. Mark Andolina is part of the expert team treating cancer patients here at the TriHealth Cancer Institute in Montgomery. He says when you get a question submitted through local12.com, as we did from Sheila about organ donation, living or otherwise,
it's really selfless. Yeah. I know, that's impressive.
This patient wanted to know, as you get a little bit older, does it help to offer organ donation, especially if you had an illness, for example, COPD? And what about bone marrow? Who's the best donor for that?
We always prefer bone marrow donors to be the sibling of the patient. We have a lot of diseases that are best treated by bone marrow transplantation, and the outcomes are generally better in terms of overall survival and fewer complications when we have the patient's sibling be a donor.
But don't let that stop you, Dr. Andolina says, from signing up to be a bone marrow donor at drives like this one at the annual Bengals Blood Drive. He says even a sibling is only a perfect match about 25% of the time, so it's important to expand the pool of living bone marrow donors. As for other organs which are donated for transplant surgery, he says Sheila may not be a good candidate for something such as a lung transplant because of COPD, which is a lung problem, but everything from your eyes to skin can be used, so don't think that people don't want your organs.
People do. There are long lists for all of these organs. Liver, heart, and kidney are probably the three that are in the most demand, but there's a lot of other organs that we transplant too.
If you'd like to be an organ donor to help cancer patients or any others, sign the consent on the back of your driver's license and tell your family your wishes. In Montgomery, Liz Bonus, Local 12 News.
We welcome your questions for our experts at TriHealth. You can submit them at local12.com by clicking on Ask the Expert.